One area of reconstructive surgery that I really like or stands out for me is hip replacement. The hip replacement procedures really have evolved to the point that the rehab is much easier. Patients are not restricted like in the old days of doing the posterior approach. We started this several years ago, and it's been a big success. Patients, in the long run, it's equal, but in the immediate post-op period, they have less pain. There are no restrictions that apply, for example, to the posterior. With that approach, you can't sit in a certain way, you can't stand in a certain way. With the direct anterior approach, none of that applies. So our patients are able to be more relaxed, and they're free to do things that in the past were very restricted. So in that respect, it's an excellent approach to hip replacement. Is everybody a candidate? Not everybody, but most people will fall into a category that the direct anterior approach we're able to use it. In my practice, easily 95+% are candidates for the direct anterior approach. Again, it's not new. It's been an evolution over the years, but in the last several years, it's front and center on joint replacement for the hip. So we really are excited about that. We continue to use new technology. The hospital has been very generous in supplying us with the equipment. The HANA table was a purchase that happened several years ago. It has enabled us to really shorten our operative time down. When we first started the direct anterior approach, surgery was lasting an hour and a half, hour and 45 minutes. We're now able to complete those surgeries in 45 minutes to an hour. With the cooperation with the equipment purchases and experience, it's become a much easier operation to complete, and our patients love it. It's not perfect, nothing's perfect, but they really have enjoyed the freedom that they have immediately after surgery, and it's really made their life in the immediate post-op phase much better. They still have to go to therapy. That's a big issue. Therapy is important. Without it, our success rate would be much lower. But all in all, the surgery alone has really helped us jump way in the future as far as the amount of time it takes to recover from a hip replacement surgery.